My name is Juan Lewis. I'm going to call this meeting to order at 11:36. It's good to see a lot of new faces and a lot of familiar faces. I think this time of the day is a better turnout. It allows us to be able to see some of you all as opposed to our 5:30 Wednesday meeting. So I appreciate you all for making the time and the effort to show up today. We have a very good agenda and a great presentation coming up, so I'm glad that you all can be here. For the record, we're going to go ahead and do roll call. So I'll start off. Colleen Rodriguez, present.
Jesse Hernandez, present.
Linda Mendiola, present.
Manuel Maciel, present.
Elizabeth Alonso Villarreal, present.
Marina Moreno, present.
Gerardo Montenegro, present.
Ramasito Canales, present.
Lourdes Ornelas, present.
Ana Guerrero, present.
Nancy Cadena, present.
Alex Kyle, present.
Jessica Baez, present.
Guillermo Walsh, present.
Tiffany Perez, present. Thank you. Just to let you all know, we have a sign-in sheet, so if you haven't signed in, please make sure that you sign in. In addition, I want to say thank you to Ms. Nancy Cadena and her office for providing lunch today. Thank you very much for Chick-fil-A. So if you all like, you're more than welcome to grab your lunch and have it while we host the meeting. If not, you're very well to take it afterwards. But thank you so much, Nancy. Do we have anybody who signed up for public comments? So there's no public comments. We do require an approval of the minutes for the October 6th meeting. And the minutes are in your red folders for the commission members. Do I have a motion to approve the minutes? I have a first by Jesse. Do I have a second? Ms. Linda? We need a commission member, I'm so sorry.
Oh, second.
Okay, thank you. A second by Ms. Alonso. All in favor?
Aye.
Any opposed? Motion passes. And thank you so much, Ms. Linda, for being active. But this is where our commission members have to be more active and do the voting. But thank you for that. Moving on to the administrator's report. Mr. Walls, do you have any updates for us with regards to the detox or anything else?
I do not at this point.
Okay. We are moving on to discussion and possible action of our membership. Again, I can't stress it enough in every meeting that we are wanting to be very active with our community, and in order to do that, our commission members need to be just as active. So in the last couple of meetings, we've reviewed the meeting time and day, and right now it shows that this time and day is working out for the most part. If in the future it does change, then we will definitely consider another day or another time. But as of right now, I think we have good participation, and I think Jesse's made some invitations to Pillar and Scan and everybody, just to kind of make sure that you all are a part of these meetings, because we want to know what's going on in your agencies and how we can get more involved with you and in the community. So at this time, the time and day is working out, so we will go ahead and continue to have these meetings at this time. I can't stress attendance and participation is very important. At the last meeting, we discussed that if commission members would not be participating, then we would definitely be going based off of our bylaws that state that if they're inactive, then they would no longer be representatives, and we would advise city council or county commissioners to let them know that their appointee has not been active. In addition, I don't know if anybody has given Mr. Walls the Texas Open Meetings Act training. That is, and by that face I can tell you have not. But the Texas Open Meetings Act training is required as part of our appointment. And so I wanted to ask Mr. Walls, which he stepped out, to see if we can go ahead and set up a deadline. That way we don't have to bring it up at the next meeting. So before the end of the month, make it a point to send in the Texas Open Meeting Act training and your certification for the city secretary that is required. Mr. Walls, I was just saying that you haven't received anybody else's Texas Open Act.
I have not.
Okay, so we set up a deadline for the end of the month to make sure that everybody gets that completed. Mr. Walls will send out that link so that everybody can do. It's really easy, and it's really good information. So I encourage you all to get that done as soon as possible. Moving forward, we are discussing the work group reports. And I know that Jesse is leading the detox facility update with Margarita. So do you all?
And Gerardo,
And
yeah.
Gerardo, were you all able to?
Yes, we were, and we have some important issues that we need to discuss on how to bring that. So, in the detox committee here that's present is Gerardo, who was original member, Margarita, Ana, Ari, from Pillar. And our discussion had to do with what we want to do with this detox program. And this is going to be, and I'm making this public, this is a medical detox program. This is what we need. This is a first step to go into residential. We haven't had a detox program radio since 2003, and our discussions, and you can correct me if I'm wrong, we've always talked about medical detox. At the very beginning, Guillermo, wherever you're here, back when we started the first Drug and Alcohol Commission, where we were looking at triage, crisis stabilization, detox, it was a model that WestCare used in Las Vegas, where they actually had people that might be under the influence, and they'd bring them in, and some of those people could stay there, and they got better, they'd leave, but they also had detox. That was a model that we originally talked about here, but nowhere, and we had our meeting, and everybody agreed, and I want to make sure that we agreed, and we've agreed that this is going to be a medical detox facility that will facilitate people getting in residential services, where they be at Pillar or where they get some of our resources in drug court. This is going to be medical detox run by a doctor and nurses. And the last time we had a meeting about this, the people from Vivitrol were here, and we were talking about Vivitrol being as part of our medical protocol when Dr. Gonzalez here. The question that came up was, are we going to go ahead and do this thing that WestCare does in Las Vegas, or are we going to do this thing that Bexar County did as a pilot project in where they got money, and it was a rider where they were bringing in homeless people and having them inebriated, and then they would clear up, and then they could do detox? No, we're going to do medical detox. And hopefully even maybe someone that's accredited for hospitalization, like SCAN is. Not saying that SCAN is going to be a provider, but they are accredited by JACO. And so I wanted to bring this up so that everybody is clear. It's a medical detox. Okay. There's going to be a doctor's run it, there's going to be protocols, there's going to be a nurse practitioner, a nurse that's running the unit, there's going to be nurses around the clock. We're going to have a triage, which the triage would be the LPCs, because we're treating co-occurring psychiatric substance disorders, will go ahead and do their assessment, and if they meet the criteria by the state, then they will be brought in to the detox program. If not, they will be referred out to different providers. When we were talking about crisis stabilization, because you do a detox for 4 to 7 days, depending on the situation, but there's some people that may need crisis stabilization. For example, you want opiate addicts that maybe there's a 333% chance that they're going to overdose. If we send them out without anything, we want them to stabilize a little bit more, and they all have co-occurring issues. Alcoholics that went through really bad withdrawal, or even some people that are using sedative hypnotics that can go into seizures. We want to give them some time for crisis stabilization. This is not going to be somewhere where people just come in and they're inebriated. Well, that's one of the criteria, but it doesn't mean that they're going to meet the criteria. So somebody can bring them in. They can come. We can admit them 24 hours a day, 7 days a week. They can be referred by the drug court. They can be referred by family. The police can bring them in. But if they don't meet the criteria for the state, then they won't qualify. So I wanted.
We won't be able to vote on it until the next meeting because it has to be
Okay,
officially on the agenda.
so this is what I would like to vote, put it to vote, and Gerardo, correct me if I'm wrong, what we were talking about was, I want the committee to vote that this is going to be used, our facility that we're getting ready to build is gonna be a medical detox facility, following the statutes of the state.
Texas Administrative
The
Code
Texas
448.
Texas Administrative Code, Chapter 448, and we're gonna follow that. And that's what we're gonna do. It's not gonna be anything else.
Now, may I ask, just for the record, as opposed to
As
not
a-
being medical, then what would it have?
Well, there's
been?
different types, different types of detox. There's social detox.
Okay.
But the question was, can we just bring in people and let's say they're under the influence and have them sleep it off there?
Instead of taking them
In-
to the
Instead,
jail.
instead of taking them to jail, and I said, absolutely not.
Okay.
This is a medical detox, there's criteria that has to go in there, so, Pillar and Scan have these programs now where they can go out, they have mental health providers can go out with police, the sheriffs, and they can actually probably refer some of the people there. EMS has the skills to determine whether or not they can come in to a detox program, but this is not gonna be where someone has a DWI and then you bring them in and anyway, we have no capacity to hold them because they can leave against medical advice. And so we need to follow the protocols that the state set up for a medical detox program. And that's what I wanna take the vote on because
Which will be the start of a lifestyle change for these people.
yeah.
And that's the whole purpose, because it's a long process. 6 months is still, I don't think, even enough time.
Yeah.
But using all of the agencies that we have around Laredo to service these people, I think we could.
And I think a very important question, and that might be a question for you, Mr. Walls, who is actually going to be budgeting for the actual detox facility and the function?
The city
Okay.
will run it, the city will budget for it.
Well, the city, I don't know if they'll run it, they'll contract somebody to run it. Yeah, I mean, that's the way I understand it.
It's something like that.
Yeah, okay.
But, from what I understand, they're still talking about how it's gonna actually be done.
Exactly.
It's not next month, and it's probably not 2 months away, as much as we want it to be. I still think we're maybe 6 months at the minimum.
So Guillermo, the reason I brought it up today was because it was an issue that was brought to me, and I won't mention how it came up to me. And I clarified it, and I said, this is gonna be a medical detox, and that's always been the case, other than when we were talking with Westcare when they had a different model. And, at that time that Dr. Gonzalez was here, he knew it was gonna be a medical detox. And so I just wanna make sure that we are all on the same page, because we have to finish phase 1, which is a detox, and move to phase 2, which is, okay, let's look how we can build a residential. Not to take away, like I told Luis the other day, it's not gonna take away what you have, it's gonna enhance what we already have in the community. And then we have to bring in all the aspects, because we have to treat co-occurring psychiatric and substance disorders. That's why we have to have LPCs on board. And so I want to be able to put this up to vote, because a question was asked of me, and I said, okay, this is the only way I can answer it. And I'm gonna answer it by following Chapter 448 and explaining this is the way, Texas Administrative Code, Chapter 448. If anyone has a problem with it, then, that's gonna have to be up for discussion, but we can't we have to follow the protocol of medical detox. That's the whole discussion we had this week in our meeting. We all agreed, and I even asked, have we ever talked about anything other than medical detox? I don't think so. I don't think we ever have talked about anything other than medical
No,
detox.
I think it came from a city council member, and they're no longer around, so.
So, just
No, and I can remember that the conversations that we had was when discussed it with fire, police, and both hospitals, and talking about how it would be a medical detox, and that we would need their support, and some of the monies was either going to be shared between the hospitals, and that's where I was asking Mr. Walls to find out where the budget's going to fall under, and see if that's ultimately the number
Right.
From
one question
what I
to make
understand,
sure.
the city is putting the operation.
right, that's what I understand.
So, and I agree with you, I've always heard that it would be a medical detox facility. However, I would wait until we get the approved permit and application back from the state and take it from there.
Well, I agree. I believe that it's approved permit and license, it's gonna be a license from the state. We're having someone license it. They're gonna license it in their Texas Administrative Code, Chapter 448 for detox. So that's not gonna be a question about it. That's my point. And so, I just wanted to address this as an issue that we need to just go ahead and agree on.
So the issue, Jesse, right now, there's debate whether it's gonna
There
be.
was a question asked of me,
Okay.
and I answered it by saying, no, I believe that other than the time that WestCare wanted to do this, they wanted to follow their protocol that they do in Vegas, and that was in 2013. We've always, in our Drug and Alcohol Commission, we've always talked about a medical detox.
And
Which,
if there is a conflict in the future, who supersedes? Is it the commission? Is it the city council? Would it be commissioners? I mean, that's something to look into. I'm sure we can't answer it right now.
I don't know, I
We can
mean,
take a vote, but if.
well, all I'm gonna say is, all I wanna do is take a vote, and that's what we agreed
The
on.
the recommendation.
The recommendation from us, that's all,
Commission.
yeah, that's all the vote is, that's what we recommended, because we had a medical detox back when I first started in the field, 1988, then it moved to social detox, and then we lost that because an agency did not put in their grant on time, and we haven't had a detox since 2003. Okay, and so we need one for adults, and we need to, hopefully, in this particular program, have adults and adolescents, so I just want to make sure that we take a vote and say, this is what we've talked about, this is what we've agreed on.
Yeah, and that's what the purpose of our commission is to bring recommendations to the city
Right.
council and to the county to allow them to know that, per se, this is a group of experts and people who have researched it and people who are in the community that know better, and this is what we feel that the community needs. And so, I think we can definitely put it on the agenda for the next meeting and put a recommendation as to, the medical detox, program, and then maybe proposing that even eventually to the city council so that they make the ultimate vote and we close that and see. if it
And
can be-
and eventually we can make a presentation to city council and them, but I think you and I are on the same page, all I've ever heard was medical detox, that's all we've ever talked about.
Yeah, and I agree that the Laredo Webb County Drug and Alcohol Commission would make its recommendations to the city saying this is what we
Exactly.
feel is the best course, or the best avenue for this facility. Yeah,
Okay.
definitely, that's exactly what we're here for.
And I think moving on with your part of the detox committee, Jesse, Margarita, Gerardo, and everybody who's a part of it, I think maybe putting down the steps for the next thing to maybe get an MOU or an MOA with all the services that are the agencies that will be servicing the detox facility, and then working towards that.
I'm already working and Gerardo and Marita and Adi and Ana, they weren't there this week, but they already know that I'm already working on at least the protocols that I'm going to submit. And of course, we have the agencies here because we're going to have to make referrals. And as I told Lee, Scan's always here. I'm glad Pillar's back again in the picture. We have to use these resources because, you know, we're at capacity. The drug court's at capacity. Scan, Pillar, they're treating quadrant 4 clients more severe. So they're not, they're doing outpatient services, but we don't have any residential, we don't have any detox, so they're having to service the more severe clients, quadrant 4 clients. And so it's harder to treat quadrant 4 clients when, you're set up as an outpatient, intensive outpatient, but Scan and Pillar have done a very good job doing it. And they're equipped to do it, so that's something we can do in our committee. But this was something I wanted to address as a very important issue to let you all know.
Thank you very much. Thank you so much for your hard work. I know that this is the most active subcommittee group, and it obviously has a great mission up ahead. And so I appreciate you all taking the time to be a part of it and to be able to research and make these recommendations. So thank you very much, Jesse, for leading the group.
And you gotta remember, Gerardo did all the initial work on how the facility was gonna be laid out. He came in with the blueprints and all that stuff, so it's been a team effort,
Yes.
Where Gerardo brings certain skills, I bring certain skills, Marita, Ana, everybody brings certain skills to the table. And so, Gerardo had that idea, and he brought in the plans, the blueprint, and we did the initial walkthrough with those blueprints.
And I thank you all for that. I know that everybody has a different skill set and a talent and experience. Gerardo, as a matter of fact, Ms. Alonso was not here at the last meeting, and she wanted a little bit more info on the detox facility. Do you want to talk about, now that you mentioned the blueprints and where it's going to be, the location,
It's
just
gonna
so
be-
she has an idea of
Yes,
it?
it's gonna be at the old juvenile center where they have the, part of the building now is the probation department, right, for,
It's a treatment program for.
Treatment program.
The drug part.
drug-
right, and we're actually gonna use, call it the jail part of it in the back. And that's what we're gonna renovate, and I think they already finished, submitting all the bids.
Yeah.
What's the
Okay.
location? What
It's on Chicago Street,
Chicago.
Santa Maria.
Okay.
One block, okay.
4101 Juarez. It's got two addresses, but it's,
Okay.
The old juvenile detention center.
Yeah, and believe it or not, in the back, in the yard, in the back, there's enough room in the
To the
future
residential, that's our phase
to
two.
put in a residential, you know, whether we send them over to Scan or whether at Rio Bravo or there. Because believe me, once we start getting people in there, we're gonna have to place them somewhere, and that's the biggest problem.
Marita, how many clients do we have in drug court that we send out monthly or in a year?
we have about.
Residential? Just out of curiosity.
Right now, we have about 18 clients
18
that
clients.
are in residential. We have about 5 pending at the jail.
Okay, so that's just right now.
Mhm.
But all of these people could be getting services here in Reno. And that's what we want to do. And we want to open it up to the community, not just the people from drug court, which a lot of them will come from, but we want to open up the community. And we have to figure out how we're going to make this run okay? Because there's really no funding for detox, you know, in the state of Texas or even SAMHSA. So we have to learn how to bill insurances and all that, right? So those are all issues that we will talk about in the future. But I think we're off to a good start. I just want to clarify the issue of medical detox.
Well, thank you very much for that update. At this time, we're going to move on to the stakeholder agency updates. And for those of you who are new, we allow the stakeholders, the agencies that service the community, to discuss maybe something that is ongoing, a community effort, or maybe some issues or things that maybe we can address. So I open it up to anybody who is a stakeholder to discuss any programs, and we'll start off with Ms. Linda. Do you have anything going on?
No updates at this time, just if there's any new programs, or if there's any changes to the programs, definitely let us know so that we know, to keep on referring the clients that way, or if any requirements have changed for the referrals.
And you're from?
From Tropical Texas Behavior.
Okay. And could you just go ahead and give your number out again?
Mhm.
Because everybody needs to know how to use the OZAR to get our clients into whatever programs we can get them in right now. Do you have that number?
Definitely. So my direct line would be 956-381-3140. And then I'll give my email just in case. It's lmendiola@ttbh.org. BH.org.
What is it, 956?
381-3140. Thank you.
Okay.
Linda, repeat your email address, please.
I'm sorry. lmendiola@ttbh.org. I'm sorry.
3140? Okay, don't answer it.
Can I have this on?
Two people are missing.
Yeah, I think, Maria, did you say?
I did.
Yes.
Okay, I'll just call in.
Do we have any other updates from stakeholders, Pillar? Would you all like to share anything that you all have upcoming, or some of the services that you all provide?
Well, we still have our general population services. We do have several new programs. One of them, I think Jesse made mention kind of right now, which is the crisis program that we have going right now. They're working with the Laredo Police Department, that's what we know, where as opposed to sending the clients to the jail, they can be sent either to Triage, which is what we are partnering with, or they have a crisis team as well to respond to these calls. The program that Lourdes, Ms. Ornelas, and I work at is called Bridges, and that's a exclusively male program, over 18 years old. We can treat mental health issues, substance use issues, and risky behaviors as well. We have a requirement for them to take an HIV test. It's a rapid one, and that's the only requirement really that we have for them, and it's completely free, those services, of course. The general population services do have a low cost. I think it's $35 per 7 sessions. We do have psychiatric services available. We partner up with a clinic in Austin. They're called Karma Health, if I'm not mistaken. And they have a very low cost also for psychiatric services. The only requirement is, of course, for the clients to be pillar clients, of course.
Can you add about your partnership with Clear Choice?
Well, we don't know a lot about it because I'm not in the program, but I can ask and bring
Okay,
more
well,
information in the next meeting.
Okay.
But they do have that partnership with Clear Choice.
Then
I'm not sure.
There's a
exactly.
partnership, from my understanding,
Mhm.
and you can clarify, but that Pillar is developing with Clear Choice so that they can help with this particular program, the crisis program, and that's where they can go ahead and take people that are in crisis. And so I think, between that and SCAN has a very similar program.
Yeah.
We all got both the same type of funding, so
Yes.
I think there's a lot of opportunity for.
Right,
for
yeah.
work.
So I did mention we do have that crisis team, yeah.
I also want to mention something that's pretty cool about Pillar. They went through a 48-hour EMDR training,
Yeah.
and I think that's pretty cool. So you have the Pillar counselors trained in EMDR, which is used to treat PTSD, anxiety, depression. So, I'm really proud of you guys. I'm very happy for you all. And congratulations too, you had over 100% intake rate last year in your program, so.
Yeah. We're hoping to keep it up, of course.
Oh, congratulations and great work, because I think these are the services that our community needs, and without the resources, then we would have more.
And we're hoping to have more of a presence, of course, in these meetings. Yeah.
Thank you. Well, you're invited. We'll make sure that we get your email and send
Of
out
course.
those invitations, because we want to know how you're all doing. We want to know how many clients you served and how many clients were successful in going through your program. So thank you very much for that. Ms. Anna, do you have any updates with your program?
Sure. So the health department now has a new LPC intern. He's offering services to the general public. We already have 3 other LPCs, but those services were more towards people living with HIV and AIDS. So that helps us because whenever we would get part of the clients, we would assess the first visit, then we would have to refer out. So now they'll be able to stay with Mr. Rodriguez.
I met him the other day, very nice man. You still see people that have the tricurrent issues, some of them that have.
Correct.
Okay.
Yeah.
And some of them that use alcohol, maybe some of them use opiates.
Yes, and so we also have a psychiatrist also on board.
Great.
So, to telemedicine, so.
Okay, so that's something that Wes can talk about a little bit, because I think you guys are dealing with a population similar to Pillar.
Thank you for your update. Do you have any updates with SCAN that
Yes.
you'd like to share?
So, I have some updates from the prevention and intervention side. With the prevention, the Webb County Coalition, they did participate with Red Ribbon Month. They were at Martin High School, where they were able to do proclamation, the parade, the rally, but only with the students and staff from LISD because of the COVID restrictions. The coalition also participated in various presentations and events in the community to help raise awareness on the importance of being drug-free. They did participate in the DEA's National Take Back Pill events. That's held every 6 months to help the community dispose of unwanted and expired prescription medication. They collected 1,375 pounds of prescription medication in a 4-hour event that took place on Saturday, October 23rd. For November, they are celebrating the Great American Smokeout, which is celebrated nationwide on the 3rd Thursday of November, which would be November 18th. Just pretty much to encourage smokers to quit or decline to quit smoking. In regards to our prevention programs, our YPI and our YPS programs, we have been able to go back into the schools to provide prevention services. We do have, they've also participated in providing presentations to the students, and this is working with middle schools and high schools. We do have recovery support services programs as part of SCAN for adolescents and for adults. The Youth Recovery Community Services Program, or YRCS. We do provide services to youth ages 13 to 21. So this would be for any youth who not just are going through treatment or maybe have completed treatment, but there are some youth who maybe are, I guess, in the transition of seeking treatment services. But we also accept youth who maybe are exhibiting some type of, high-risk situations. We do have the adult recovery support services as well. And initially, the program was aimed for anybody with an opiate use history. But we do provide services now for anybody that has any substance use history. They do a lot of case management services for the adults, 18 and up, and they are accepting referrals.
Thank you very much for that information. I appreciate you all for all the work that you all did during the drug-free awareness week and that you all do throughout the whole year. So thank you for that update. Appreciate you all. Ms. Marta Hernandez, who is part of West Care, currently has the FACE Coalition meeting during the time that we have our meeting, but I wanted to make sure that I reported on behalf of her. They also took part in the Red Ribbon Week, and they did a 2-day conference online, and they involved several stakeholders that are present here. They also included myself as a representation of Laredo Crime Stoppers and the Drug and Alcohol Commission. So I did the welcoming speech for that day. So they had over 100 attendees in both days, and it was a really good turnout between students and also parents, teachers, and some law enforcement officers. So just wanted to make sure that I included that for you guys. Any other comments from any other stakeholders that I may have missed?
Madam Chair, yes, with LAD, Laredo and Second Drunk Driving, we don't have an office per se or see anyone, but we do, if you know of anybody that was a victim of a drunk driving crash or something, we do offer support in counseling because, as you survive it or your family members are left and, sometimes, well, not sometimes, most all the time they need counseling. So if you know of anyone, please, get a hold of us so that we can make a referral. The services are free. LAD pays for that. So just let us know. We did participate in Red Ribbon. We did a presentation at Cigarroa High School and at Delhi Independent School District. So we're glad that we're able to, continue with presentations because outreach is very important in all the work that everybody does.
What other services do you provide?
We basically that. Well, others are victims who are left. What they might need. You were mentioning, some services that, folks would have to pay. We're willing to partner up with that. We're a small nonprofit. We heavily rely on donations, but, whatever we can help, even if it's $100 to get somebody to get some services, we're willing to do that.
What's your name? I'm sorry.
Elizabeth Alonso Villarreal.
I think the one thing Elizabeth didn't mention is that they actually work with these victims, and they're there. Not only do they make sure they provide them counseling, but they go to court with them, and they're there with them by their side all through the court cases. So they provide them that support that they need. And I worked with them for a while. It's a wonderful program, and there's opportunities. Elizabeth Pillar, because I want to say there was like 7 counselors from Pillar that got trained in EMDR. So not just in your program, but in the general services. So that may be a discussion you may want to have with Manny and Arturo, because what is the rate for 7 sessions? $35?
Yes.
That's very cheap.
What's your number?
956-740-3233. And our website is supportlad.org. And you can find us on Facebook also. There's a lot of outreach there.
Thank you so much, Ms. Alonso, for your update. Any other updates from any stakeholders?
I'd like to give a non-drug and alcohol commission update. You know, we're really excited here at the health department. I'm gonna stand up so everybody can see me. I'm Ken Wallace, acting assistant director. I'm sorry that we're in such a small room. Next month, I'll absolutely make sure we're in the bigger room and we'll figure some way to move that camera over there. But congratulations, Colleen, on having such a great turnout today. And like you say, I think this is the right time to do this. But we're very excited because maybe 5 minutes ago, we gave out our first pediatric COVID vaccination. So if you guys know anybody, if you have kids, you know, bring them by. We're giving out Pfizer's from 5 to 11, and of course we have we have all three, Pfizer, Moderna, and Johnson, available up until 5 o'clock every day, and we don't leave until the last person leaves. So welcome here. Monday through Friday. Yes, ma'am.
And thank you, but you know, remember, it's such a big link with COVID and how it's impacted adults and adolescents. A lot of them started drinking more,
Absolutely.
using more drugs. So I'm glad that congratulations on that, but there's a big link between COVID and our substance use issues.
And not only that, just mental health.
Mental health, oh,
I
yeah.
saw it at
Oh.
home with my kids. You know, they didn't want to go home, and then they didn't want to go to school. And, you know, we were trying everything, and whereas I was raised in, and I'm sorry I'm going off on a tangent, but if you know me, I do that all the time. But, you know, I would always tell my kids, hey, straight A's, you have to get straight A's, you have to get hundreds, you have to get hundreds, and now I'm at the point, just be happy and survive.
Yeah.
So I think that's what we all do, so
Yeah,
I won't take any more time.
they've been put under a lot of pressure, and I think we all have one way, shape, or form. So that's great news, Mr. Walls. Congratulations on that, and we only hope that more people can get vaccinated so that, you know, we take care of one another. And ultimately, it's everybody's choice, but hopefully that prevents a lot of the COVID spreading, which, as a matter of fact, I think it's at the lowest, so we're in a good state of our community. Thank you for that. We're gonna go ahead and move forward with our community presentation, and I'm going to pass it to Mr. Jesse Hernandez, who's going to introduce our speaker for today.
Okay, so I invited Mr. Wes Cow from Alkermes to come down because it's kind of like the last time we had a meeting in person, we were talking about Alkermes was here. They made a presentation. We had just gotten the MAT grant that the county was going to use medication-assisted treatment for reentry. We were talking about that. We were talking about how Vivitrol is an important medication that can be used, much more efficacious than methadone or other medications. This is the way I see it. And we've been using Vivitrol in the drug court since 2013, I believe, Monday, 2013 or so?
Yes.
And the first 3 years that we used it, we saved our community over $560,000 in hospitalization, going to jail, recidivism rates were low. And so from a $950,000 grant, by saving that money, it brought in our community $1.4 million. So we are big proponents of Vivitrol. And so we brought Wes in for training for the drug court, the veterans court, and pillar. And I wanted Wes to just explain a little bit about Vivitrol and what it does.
Sure. Can I take this thing off? You're okay when I talk? I'm about to have a panic attack. So yeah, thank you, Jesse, and thanks for having us here. Y'all have something here. Thank you for what y'all are doing. Y'all have it built in this, we like to call it an ecosystem or a web, if you will, where we can track the patient and have them start on Vivitrol and give them the best success rate by going into counseling and staying active in their community, all those things. So my hat's off to y'all. You have everything set up in place. It's really the hardest part about my job. I actually am not like a sales guy. I'm just not. My main job probably is procurement of Vivitrol and just getting it to patients. A neat thing about this medication, I don't know if anybody or if y'all are familiar with it, I don't mean to talk down or anything, but essentially Vivitrol keeps you from having euphoria. So if you are to drink alcohol or if you're taking opioids, it's pointless. You're not gonna feel anything. I mean, you're just not. You're not gonna have that dopamine rush, and that's what Vivitrol blocks for 28 straight days. So, I mean, you can kind of put together what that looks like for your patient, you know, when they're having that one moment per month when they wake up and it's like, okay, I really need to quit. This is that moment. I wish I could jump out and hit them with a Vivitrol shot right there. But that's what it'll offer, 28 days of a peace of mind. And now they can still have all the crap of the DWI stuff. They can have the fall down drunk and get a hangover, all the repercussions, but no fun, none. And so it's, why would you drink, right? It comes to a point where in the trials they tried one and they were just like, okay. So it's pointless to do that. So if you have somebody, and this is what we talk about, give us the hardest one you got, the one you've seen over and over again. Try it. I mean, it's really one of those deals where a motivated patient in the right circumstance, Vivitrol can change their life almost immediately. Particularly, it's the gold standard now for alcohol. Vivitrol you can't have opioids in your system when you take it. So the detox aspect is where we really have to live with Vivitrol because it can put you in a precipitated withdrawal. So if you have it in your system, it has to be cleaned out, so to speak. And that's something that, you know, medically supervised people like y'all know what you're doing. It's a done deal. It's about 4 to 7 days. I would probably guess you can probably get it done. Vivitrol, I'm sorry.
Yeah, I just want to add this, you know, we're talking about Vivitrol is the injectable form of naltrexone that's been around for years.
Exactly what I was saying.
Okay. And we use it a lot for opiate addicts, but we're not using the convenient enough for alcoholics. And I'm glad that West are targeting that because it is a dopamine receptor blocker, prevents euphoria for the use of alcohol. So go ahead. I just wanted to add that. I think you're targeting the alcohol, which is very
The
important.
state has moved funds to this issue. The TexasMood.org, I don't know if you're familiar with that, MOUD. They're changing their name. I mean, they are allocating, I think it's more around $4 or $5 million just for the alcohol component and Vivitrol being a part of that for the uninsured patients. COVID made things go bananas. 300 times more alcohol sold in the first month. 300 times doesn't seem like much, but when you look at the number and the data on it, it was a ton. It's not that they always maybe have had some drinks and Vivitrol is not maybe going to end all be all, but it was able to meet them where they were and reduce their heavy drinking. And that's what our clinical trial was able to show. We have coverage in a lot of the places, like what Jesse was saying, the Medicaid, the VA is a major client for us. And it's because they see the value in having the Vivitrol on board, the long-acting injection, because the naltrexone molecule works, we know that. The problem is you have to take it every day, 5-6 times a day. Well, I like to tell the deal where the only way I don't know I take my heartburn medicines when my throat starts burning. So it's kind of like one of those, it's hard to stay compliant, but the medication works, so when we put it into that oral system, to the shot, it stays in their system for 28 days. Had a 55% reduction in opioid cravings, self-reported. We don't know why, point blank, we don't. There's a lot of things that we can lead to or try to put commonsensically together, but we don't actually know why. It was quite a find in our clinical trials. I think they were very excited. And to that point with the clinical trials, they all had HIV, not all, but they had Hep C, HIV, on antidepressants. Liver function had some problems there, and there's some things that we have in there with safety for that. But in general, these are the people that you're going to see and have the opportunity to be on Vivitrol. We have some new stuff in the uninsured patients, and in order to really get those funds, we have to show, like what Jesse's talking about, a continuity of care. Because you can't just give them, Harris County is a good example. They bought, I guess, probably 80 doses or so from us recently. But they had, and they put in that kind of pilot, and he's already got it exactly how it should have been. But they have this deal where it's the same thing, where you have counseling, you can follow them into the community. They get their shot right before they come out of the wall, and then they go to a FQHC, and literally they bus them to that place, and they're following them. It's one of those deals where, it's pretty strict. the neat thing about those funds, it's not limited to one shot to one person. So if you have a super motivated patient and they need a couple of months, because a lot of times they recommend, Jesse said 13 to 18 months.
Well, that's the program, but
Okay.
but what I've always heard is 6, and if you can get them into 12, 13
Right.
months, the efficacy of recovery is a lot better. But
Very
every client is
Sure.
different.
And they have things like from the first shot to the second, it's called waterfall data. You have like a 70% better chance of them going into remission. You know, it's just one of those things, in my opinion, this is sort of my opinion, but if you have that on board, there's a part of that that mentally gives me stability, right? So I have that on board, and in the clinical trials, they doubled up their time in counseling while they were on Vivitrol. Double. So if we can keep them in those programs, that's really where the hard work is done. It's not the shot. Shot's half of it. If you're not willing to do the hard work, I've heard of a guy in the Galleria area down in Houston, 3 years. 3 years on Vivitrol. I mean, you know, not for nothing, but you might want to address where it hurts. All right, where's the pain, man? Got to figure it out. But 6 to 12 months is about what we see in general. Like I said, I don't really get paid on that. It's not some thing for me to be like, oh, keep them on forever. What I can say is 1 to 2 months, certain people do. Amazing. I mean, you can think of how that could be, but think of your frequent flyers. And that's how I like to put it. I don't mean to be rude, but the ones you see a lot, try them. Why not?
And if you follow the protocols from tip 42 from Samsung, you want to treat co-occurring psychiatric and substance use disorders concurrently and aggressively. And so we can stabilize them from using heroin or alcohol. They're going to go ahead and capture their mental health, their psychotherapy a lot better. And that's what we want.
Addressing the alcohol is a big deal.
And I do, you know, alcohol, for me, it's a big deal. We already know it works really well for the opiates. We're not going to use opiates. But, you know, we need to get it out in the community. We're looking at ways that we can get more doctors involved, more nurses involved, more community people involved. I think Jessica talked to when we had lunch with Luis and I think he mentioned he might be interested in something like this for the new grant. And so, you know, that's another introduction. I told Wes next time he's around, I'll be happy to introduce him to Luis.
This is what it takes, though, and what I've seen. It takes the stakeholder meeting, it takes everybody doing it, but y'all got some neat stuff right here. And this room's already got pretty much everything you need. So it's a policy and a program that once it's in there and they pilot it in so many different areas, it's so effective. It just is. The DWI courts is a great place, but not just there, and I don't mean to pigeonhole it, but it's the ones you see over and over again. We can change their life. We really can. It's amazing what happens. It really is. Like I said, I'm not a sales guy. I'm not. My whole job is procurement. I don't really have to sell it very much. That's probably, that guy will sell it faster than anybody. I've never seen somebody so passionate about Vivitrol, but he knows what it is. It's non-narcotic, it's non-diversive. In a lot of ways, we're the good guys. You know, I mean, these people that are staying on methadone, not that they don't need it, but they're incentivized to have those patients. You start paying people to have 200, exactly 200, you know, on Sublocade or methadone, I don't know what you're doing. You know what I mean? You're just keeping them on it forever.
They're on maintenance, where
With
here we have an opportunity to get them off.
Right.
And, you know, this is a more humane approach even than Antabuse for those alcoholics that we've had to use Antabuse with in the past. And this is a lot better for opiate addicts because, the first addicts that we had in the United States were Civil War veterans, and they came on. They were morphine, and so then Bayer invented heroin to get them off of morphine, and now we're using methadone, which is much stronger to get them off of heroin. And the withdrawal for methadone is so profound and so intense. They have to be weaned off. There's a lot of different issues going on. It's a
Can
rough
they transition from methadone to?
Yes, but they have to go through a detox protocol.
Mm-hmm.
So Margarita and we were discussing a case that we had in the drug court who was on the methadone program. Nothing wrong with medication-assisted treatment. Some people do methadone and it has worked for them. But sometimes programs don't monitor as well, and so if they're using methadone, they can also use heroin. And, you know, they're checking it for drugs, and they can use methadone and heroin, and they can use pastas, and they're using all sorts of things. And so we're talking about this client, let's go ahead and get her into some type of detox, whether it be the jail detox or what have you, and then have her as one of our first clients to go into Vivitrol, because she's been using opiates for many, many, many years.
Diversion is a big deal in the methadone and the Sublocade world. They have these different things. I mean, it's crazy. Like cheek it. Y'all ever heard of that? They take this Sublocade piece and they put it in their cheek because it's their daily or whatever it is, and they come out and sell it. I mean, there's a lot because it's narcotic. That's the cool thing about Vivitrol as well. Non-narcotic, non-divertible.
That's what I became a big fan in 2013. I was in Tennessee at a meeting, and I met the people from Walkerme's, and that's when I met Jesse Jones. And when I got explained everything, I said, okay, I got this, and I immediately wrote it into the grants.
And we have a lot of that.
And the model that we use is called, it was a model from New England called broad spectrum treatment using naltrexone. And I tweaked it to use Vivitrol. And broad spectrum treatment includes the Vivitrol shot, which locks them in for 28 days or so. You use cognitive behavioral therapy, motivational enhancement therapy, and AA. But I recommend, if we're going to use AA in any facility, you do in-house AA, because right now our AA groups are overwhelmed with just the judges sending everybody, and we don't want our clients to be exposed to that. But I think if you use that protocol along with different models to stabilize them, I think we're in good shape, and we've seen that in the drug court many times. And today our push really has been, let's get it out to people who are using alcohol, or in our veterans court, all the alcoholics. So
The VA is my largest account,
and
unfortunately.
And here in
Free to them, by the way.
And in drug court too, where we are the only felony DWI court. You know, let's get it out. We know it works with the opiates. We're going to use it for opiate use disorders, but let's also get it out there in the community and educate the community. And that is my whole goal here, for you guys to just go educate people and come up with more ideas to educate more and more, so Vivitrol can be something that is in the community's mind.
Have y'all heard of it before?
What is the cost for self-pay?
About $1,000.
$1,000.
I don't care. I don't mean to be rude, but I don't. The shot hurts too. So, how much did you spend last month on drugs? How much pain are you in general? I don't care.
$1,000 is really.
This isn't a regular pharma job. You know when they hit you with that, hey, what about with the
Administers the injection, the doctor's office.
any doctor's office, and we can train everybody and all that stuff. The neat thing about Vivitrol and Alkermes is they didn't even put the name of the drug on there. Did y'all notice that?
The only one.
It's not like that for us. What we're trying to do is make sure that people know about it, period.
It's important to educate the medical field, our local medical field, because we only have one physician that administers the shot in the community.
Who's that?
Dr. Arsaongora.
We can fix that almost overnight.
And I have to send people from my private practice out of town to get a Vivitrol.
San Antonio,
Yeah,
right?
San
And we need a
Antonio.
prescription. right?
You need a prescription.
And so we have some ideas of how we can educate our doctors and our nursing community, so that we have more people understanding the benefits of Vivitrol.
2006. And I go into addictionologists and residential treatments, and they don't even know about it.
Well, see, and not that we want to sell Vivitrol, because we're not in the
Gosh,
business of
no,
doing
we're
that
not.
either. But I think one of the suggestions that we can do is probably host an event to invite our medical staff members to learn more about not only Vivitrol, but other of the resources that we have available, because if Dr. Gongora is the only one who's administering, and that was my question, is like, well, who administers it if it's only one person, but then you have clients or patients rather, that you know that may need this, then why not be able to offer it to them if you can offer them XYZ medicine?
In the past, that used to be considered weak.
Yeah.
You know,
So-
it's not, you gotta do it by yourself.
So Guillermo, the last thing that Dr. Gonzalez was working on before the COVID pandemic, because we had the presentation from Vivitrol from Alkermes, was setting up a meeting with the hospitals so we could provide the doctors CMEs, so they would come in.
You know, we have a hospital program that's free to them now.
Oh,
Under
yeah.
200 doses.
Yeah.
We'll give it to them. Give it to them.
Well, you know, so we
Got a lot
have
to
to
do.
educate them, and that was the last thing that we were working on, he was working on, to try to get the doctors involved. Today we were talking about how we can get the nursing programs involved, and get more people to understand the benefits of Vivitrol. So that,
Counselors offering it to
I
them.
actually
and
just
like-
finished working with the nursing program with Tammy because they did something that is nursing in the community, so they wanted to know what resources are available to the community, and Crime Stoppers was one of those, and so they actually promoted Crime Stoppers. It's funny, but I'll go ahead and reach out to Ms. Linda Casares, who's the director.
she's right, Rosie's no longer the director?
No, I think she is there, but they have different instructors, and she was part of this class and supervised this group, so I'll go ahead and let her know.
Sure.
Because I think that would be a great opportunity. I think if
I'll
we
go
can start
anywhere, anytime,
connecting,
guys. I'll meet anybody.
educating,
I don't care. Anywhere, anytime. Just that.
and that might be a connection with you, Ms. Linda, with the resources that you have available, that includes Scan Killer and the City of Laredo and LAD and everybody. I think that that's something that we can try to encourage and push out with the Drug and Alcohol Commission.
That would create a movement.
So I guess if somebody wanted a shot for self-pay, where would they go and get it?
This is the problem.
San Antonio.
That's why we, San Antonio?
Until I can get
Yeah.
people trained here, but the overall structures here, because to be honest with you, the counseling is more important. And we look at that like that, and where they go and how they get that continuity of care is what we call it in our business. That's a huge deal to us, and it's important. Just about, we can train almost anybody to do the shot, and we can get other people, psychiatrists, to do the prescription side of things too.
Any adverse effects?
The adverse effects, there are two that you should know about. So nausea comes up front because of the spike, right? And then that just kind of makes sense. And then the other one's the injection site reaction, an ISR. We have REMS kits for that, and we do a lot of training. I actually have a clinical nursing educator who'll come out, and we'll all do the demo together if y'all want to. It's kind of fun, actually, but somebody has to let me shoot them. So y'all can decide who's going to take the shot. But it
Jesse.
That was easy.
Are you thinking that there's a reason for that?
Is it in the arm?
I'm
Is it
sorry?
in the arm?
No, it's in the body. It's a
Okay.
2-inch needle. And so it's literally taking not literally, but it's taking like a microsphere and putting it in the adipose tissue that's going to break down for 28 days. Again, the money and the pain, I don't care. I mean, you tell them that too. It's like you've been planning about getting a shot.
Yeah.
Really?
I
That's
know
your
for a
heart.
fact that they have it at Border Region because I have a ex-stepson that actually got it and he was on the treatment. I believe it was like for 12 months.
Are you
and
talking
he-
about Vivitrol at Border Region?
Yes.
They have it?
Buddy,
yes.
that I didn't know.
Yes,
And so we need to
he's
link
doing
that.
great.
Because they have to treat
Right.
co-occurring
Yeah.
disorders, and they have to do medication-assisted treatment.
Yeah.
They
Have
have
to.
grants.
So they have to screen them too.
So I didn't know that.
Which is
Yeah,
wonderful
yeah,
for
they're doing
alcohol.
it there at
You gotta
Border
screen them.
Marina,
And I think I remember calling you about that specific person. Remember that he was at the drug court
Oh,
and he couldn't get it. And
well, I'm glad that you
Yeah.
got it. So Marina, go ahead and tell Wes a little bit about what you do. I was telling him what you do and what your program's about, but you didn't mention your program.
Yes, sir. I have an organization. It's called Mike's Purpose, and my son actually died from a drug overdose from an opiate. It was a cocktail of drugs that he had in his system. But I know the last thing he was doing was heroin, and I mean, I didn't know about this. I didn't know about a lot of the stuff that I have learned here already, and I wish I would have, right? But so now what I do is I go to schools and I present my son's story and I go also. I've been doing the virtuals also in Harmony and a virtual in Memorial Middle School. They actually did the whole school that watched my presentation, and just trying to save a parent from going through what I went through.
Thank you for what you do.
Little known fact that I may be the only one, other than old timers and scam, know of. In 2001, Laredo had the highest admission rate for opiate addicts, adolescents in the state of Texas. So we had the highest admission rate for adolescent opiate addicts in Laredo, Texas.
Our
And-
populace, right, it was a percentage.
Yeah, the highest admission rate. And, you know, that's amazing, you know, and we still have those people and they're hidden. And, you know, I'm 64, you know, we are, you know, I treat a lot of adolescents with heroin addicts for a long time. And we need to break the cycle. That's all I would want to encourage you all to do. And when I'm working with clients, one of the things I tell them, you know, I wanted to treat you not only with dignity and respect, but I want to treat you the same way I want a family member to be treated if they're in a similar situation. I would not recommend Vivitrol if I didn't believe in it. I would give it recommend it to a family member, and that's the absolute truth. From almost day one, when I understood it, the pharmacology of it, and how it could benefit, you know, I've been a big fan because I've been around methadone, I've been around buprenorphine, I've been around antabuse, been around all that. But, you know, for me, this is the greatest medication that has come around so that we can effectively treat people with co-occurring psychiatric and substance disorders in a more humane way. And I believe in it. And I don't get paid by alchemies at all. I just been a huge fan.
Right, which is good. One thing I did want to add is, oh shoot, go ahead.
I was gonna ask
Sorry,
how many.
I've worked 8 straight days, guys. I'm sorry.
I was gonna ask, do we know how many Vivitrol injections have been administered here in our community in the last, I guess, whatever you have data for?
Marita, you can pull up that data from the drug court.
I can put it up. I can tell you though that with the pandemic, the injections stopped between March and May of 2020, and we have yet to pick it back up.
And that was a result of doctors not seeing
Correct.
patients in their.
Black
Correct.
adjudication.
And actually
was
during
part
the
of it, too.
time, I wasn't with the drug court, but at the time, there was 21 shots that, or vials rather, that the doctor was storing for us, and because of the pandemic, 13 of them expired.
What's the length on that?
Oh, don't tell me stuff like that. How long is that? 13?
About a year, so but they do have to be stored in a
Fridge,
freezer,
right?
a fridge, I'm sorry, yeah, and it's gotta be certain degrees, and
It's just
so
an average.
once you take it out, like, you have to administer, it's kinda like a COVID shot, I mean, it goes to waste at the end of the day if it's not used.
We could just always send them across the river and give them over there.
One thing I did want to add, one last little thing was, you can still get runner's high, chocolate high, all that. It doesn't squash your fun of life. Just so we kind of, I've had people ask me that before, like, I'm not gonna have dopamine that come from that opioid receptor, that mu receptor. That's the difference. That's what gives you that's the euphoria side of it. So I just want to clarify.
I was working with a young man one time, about 21 years old. He had been sexually abused, but he was using opiates. And we got him on Vivitrol, and he wanted to check it to see if it worked.
Mm-hmm.
And he was working at a pizza place, and somebody offered him Awada-chango, nasal heroin. He ended up in the hospital like that. He went into immediate withdrawal, and so it works. And that's why people say, they're not going to use it.
The oral one was called the buzz killer for a long time. And the problem with the oral one is they quit taking it on Friday. It's like, all right, let's roll. And then Monday morning.
Now, the model that you talked about in Houston, the grant that I wrote on behalf of the Drug and Alcohol Commission a year or two ago, the Medication Assisted Treatment Program, we got it funded.
Mm-hmm.
And we had, I want to say, over 100 doses to give our population. We could use it however we wanted, one at a time, or up to 6, depending on how Pillar was going to be doing the counseling. Unfortunately, because of COVID pandemic, that plan fell apart. But I do want to work with Aaron because we have that grant polished, and I want to go ahead and see how we can go ahead and bring that money back into our community because that was 100 or more doses, and the health department was going to help us doing the purchasing because they could get it at a lower rate.
Well, we can do the Bessie uninsured rate for you guys. We can set up an account. That's what Harris County did, and there's no better rate in the world. which is, I mean,
Yeah, that helped us a lot, increase the amount of.
you get more doses.
Yeah, so we can get
more
more
people,
doses.
more people.
So that was what we did, so, I'm ready to do that one again, as long as you call Erin and have her connect with me.
Our government relations lady worked for the Governor Abbott for like 15 years. She's probably like my age, I guess. She knows I'm working on something. She's like, I'll call the director. Oh, okay. I have his cell phone. Oh my God. So she knows a lot and is able as a resource to come in and really help with it. I mean, our community has a lot of resources. I'm going to back up the truck for y'all. You know what I mean? It's just whatever I can do, however we can get it to people. Thank y'all for your time. I appreciate what y'all do.
Thank you so much for your information. It's been a wealth of information that I think we definitely need to get out into our community, and more especially to our medical field, to our doctors and our nurses, to know that there is this medicine that can definitely help. So thank you so much for your time, Wes, for coming out here. And thank you, Jesse, for the invitation. We're moving forward and almost done. Do we have any other announcements? Any announcements that you all want to share?
Not an announcement, just can you update the sign-in? There's a lot of people here that are not in the commission anymore. I don't know who handles that, Tiffany or do I want me to do it?
I think we could probably go on there and maybe send her the template, and then we can kind of start moving it. That way it has a feel of.
And then on the vacancies on the commission,
I know
are
that.
they working on that?
I know Tiffany had sent a recommendation that there was this gentleman who was trying to get in from the DWI court. Mr. Vasquez sent out an email that he had a staff member. I'm not sure that name with you. Maybe you know who it is. But that they were
members that have these vacancies.
they were trying to reach out.
Okay.
I've already reached out several times to the administrative assistants, and I think Mr. Walls had done so the same thing after I did. And they are actually reaching out to council members themselves, and they have had no luck. So we're gonna try to see if we can go one more time or try to figure out, but we do need those vacancies to be fulfilled, and those are coming in from our new council members. I think the only council member that had actually filled up was Ms. Vanessa Perez, who appointed Ms. Elizabeth Alonso Villarreal. Everybody else is still pending. I think we have Mr. Gutierrez and Cigarroa, who are pending their appointments. Okay. And then we actually had Dr. Marta Martinez appoint someone, but that person has not yet been to our meetings whatsoever.
We also have to update the website.
Yes. Definitely. We'll work on that. Nancy, thank you so much. Nancy is our secretary now, so she's really working at it.
Yeah,
She's getting pretty good at it.
Let's make sure. And it is a volunteer position, so again, thank you so much for actually having to take that lead, because it keeps us on our toes, so thank you for
And I
that.
think we're missing one person to sign in. I don't know. Counting wrong. Everybody signed in?
Yes? Okay, so if you have not, please, because if not, then your attendance is not counted. It is 12:44, and I am calling this meeting to order. Do I have a first? I have a first by Marina. Do I have a second? Second by Jesse. All in favor? Any opposed? Motion passes. Thank you. We will see you December 1st at 11:30. And if you have anybody who wants to sponsor lunch, please let Mr. Walls know.